Shemai, hello. My name is Alex Howells and I am the Chief Executive of Health Education and Improvement Wales. We are the strategic workforce organisation and the statutory education body for NHS Wales. And we do this through a range of functions which include workforce planning, workforce intelligence, careers and attraction, leadership development and talent management, and education and training across many health professions. Our people are our most valuable asset in the NHS, and our job is to work with our partners, particularly our NHS colleagues, to develop a skilled and sustainable workforce that is motivated and engaged to improve care for patients and the health of our population. In this short video, we are going to share what we're going to do about this in the next 1 to 3 years through our integrated medium-term plan, which all NHS organisations have to produce on an annual basis. Our plan in HEIW supports the delivery of the workforce strategy for health and social care in Wales, and this was published in 2020. And our plan also responds to the Welsh Government's remit letter, which sets out the Cabinet Secretary's requirements for 2025-26. The plan has been developed to make sure that we make the best use of the financial allocation we receive from Welsh Government, recognising that money is extremely tight in the NHS at the moment, and requiring us to be as imaginative as possible to deliver added value. HEIW's allocation this year is around £365 million. 85% of that we spend on education and training. Although we have seen the NHS workforce increase over recent years, there are still challenges and deficits in key areas, as well as a constant increase in demand on health services from an ageing population and a population which is experiencing a growing level of chronic conditions. But we also need to recognise that there are lots of opportunities to work differently and to transform how we work and deliver care. For example, by developing the workforce models and skills that we need to focus on prevention and delivering care closer to home. Another area is closer integration with new digital solutions and technological advancements. These are critical to the safety and quality of care and can release many benefits for our workforce as well. We've identified 8 key areas of work for the next few years to take this forward. Our first priority is to develop national workforce solutions that support productive and good quality health services, with a particular focus on access to care. Waiting lists, bottlenecks in care pathways and delays are a key concern for patients and staff alike, and workforce issues are often a contributory factor. This could include clinic appointments, operations, cancer treatment, as well as urgent and emergency care. So our plan includes a number of projects targeted at improvements in our diagnostic workforce models, such as endoscopy, our theatre staffing and skills, the future development of cancer specialist nurses, and competence frameworks for end-of-life and palliative care and urgent care. A new area of work for us in the coming year will be to support the Women's Health Plan with a focus on education, training and skills development. Priority 2 is about how we transform the workforce from one which is focused mainly on hospital services to supporting preventative and place-based healthcare. We will maintain the progress we have made in improving the training for all of our independent contractor professions and ensuring that there are more placement opportunities in primary care for doctors, nurses and allied health professionals during their initial training. Working closely with Public Health Wales and the Strategic Programme for Primary Care, we will be continuing to expand the role of the primary and community care academies who are supporting development of the wider professional teams, as well as implementing other important actions in the Strategic Workforce Plan for Primary Care. Education and training is at the heart of what we do in HEIW and is the basis of Priority 3. This will include implementing the Education and Training Commissioning Plan for 25-26, which includes undergraduate programmes working closely with our Welsh universities, as well as postgraduate training, which often operates as part of a UK system. Securing good recruitment and fill rates, minimising attrition, and ensuring that students and trainees have a great training experience in Wales are a fundamental part of our day-to-day work. As healthcare needs change, we're also building new, modern education models that respond to these changes, with more flexible, work-based learning and new technologies like simulation and virtual reality to speed up the training process. Next year, this will include the development of an NHS Wales Clinical Skills and Simulation Academy, as well as continued development and rollout of Bertie Dysgu e-learning platform. Alongside this, we are also doing some work on a future-focused education strategy, which will need to reflect that the shape of care and the shape of work is changing at pace. We plan to open more doors too, whether you're just starting out or changing careers. From apprenticeships to degree pathways, we are going to be making careers in healthcare more accessible and inclusive. Priority 4 recognises the need to evolve the roles within our workforce and multi-professional teams in response to changes in need and service requirements. For example, we will be working with Welsh Government, helping to introduce the new Registered Nursing Associate role, which will expand and strengthen the skill mix to support our registered nurse workforce. We will need to support implementation of the findings from the National Leng Review into Physicians Associates and Anaesthesia Associates, and we'll continue our work to introduce the Clinical Associate in Applied Psychology within our psychological therapy services. All of these new roles need to be introduced with the right focus on safety and with the right training, supervision and planning. Our 5th priority focuses on how we're making sure the NHS workforce is ready to embrace the benefits of new digital solutions and technological advancements, because the future is already here. From basic apps to artificial intelligence and virtual reality, digital tools are helping us work smarter, faster and better. This can enhance quality for patients and help address staff workload. But to get the most from this technology, NHS staff need the right training and support. We're expanding our digital skills training, making sure that people in the NHS, from frontline staff to our leaders, have the knowledge and ability to use technology to improve care. We're also developing new education approaches so that our workforce can use artificial intelligence, precision medicine and genomics so that patients benefit from the latest health breakthroughs. This will support quicker diagnoses and more personalised care. The 6th priority underlines our important role in building compassionate and collective cultures and leadership in NHS Wales. This is vital for staff engagement and well-being, which in turn is vital to the quality of care for our patients and service users. We will continue to expand our range of leadership development programmes, targeted at various groups of leaders, and developing important talent pipelines for future roles. In particular, this will include a board members induction programme, as well as bespoke support for operational managers who are at the very sharp end of helping our clinical teams deliver services. We're also working hard to make sure our future NHS leaders reflect the communities we serve, supporting greater diversity and fairness in our leadership that reflects the communities that we serve in Wales. In collaboration with UK colleagues, we will be introducing a new code of practice and competence framework for all NHS managers over the next few years, recognising their key role in our complex health environment. The next area of work, Priority 7, is focused on the future and recognising that getting the right workforce needs effective planning. Over the last few years, we've worked closely with NHS Wales, social care partners and educators to create strategic workforce plans in key areas like mental health, genomics, nursing and perinatal care. In many instances, this is the first time a national approach has been taken to developing the workforce in these areas. The focus for the coming year is on implementing these plans to make sure that they add value and impact as quickly as possible. We're also continuing to deliver step-change improvements in how we collect and use workforce data, with the aim of launching a Centre for Workforce Intelligence so that NHS Wales can plan ahead with confidence and precision. Finally, the last priority area, Priority 8, reflects that part of our role in Health Education and Improvement Wales is to bring expert advice, national insight and practical solutions to support Welsh Government develop and implement workforce policy and to work in social partnership to take these forward. So that is a brief summary of the main priority areas in our plan. But if you read the plan itself, it'll tell you a lot more about our core business and how we work. So I'd really like to thank all of our staff, our partners and our stakeholders for their involvement in the development of the plan and for the fact that they've got such an important role to play in how we deliver it. And I'd like to thank you too for taking the time to find out a bit more about HEIW. We are really excited about the opportunities that we have as an organisation to make sure that we've got a workforce ready for the current challenges, but also ready and prepared for our future opportunities. Diolch yn fawr iawn.